Hey everybody, this is Shannon Finks with the Finks 5, where I or my students discuss a therapeutic topic within 5 to 15 minutes. And today we're discussing intramuscular injection technique. So the American Pharmaceutical Association has a video on proper immunization practices, including intramuscular, subcutaneous, and intranasal injections or administrations with vaccines. But because we have recently seen an increase in shoulder injury related to vaccine administration, I just want to take a few moments and reiterate the appropriate anatomical landmarks for those injection sites, and I want to touch on selecting a needle size and both of those to potentially avoid complications of improper technique. And as a pharmacist, we are very involved in vaccine administration, and you should all be familiar with proper injection technique. Just a reminder for us to use proper injection technique, and keep in mind that the deltoid muscle is a smaller region as compared to other IM injection sites, so that leaves a very small margin for error. What you are doing is try to isolate that safe zone. You will go 2 to 3 fingers down from the acromion, which is that top bone of the shoulder. 2 fingers down for bigger fingers, 3 fingers down for smaller female fingers, and then you can make a V with your other hand, identifying that safe zone. The axillary nerve actually wraps around and can be hit if you're not careful, if you go too far down. So it's about 7 centimeters down from the acromion. So what you want to do is look for that axillary fold or the armpit and just stay above that. In another diagram, this will show you kind of how the deltoid muscle wraps over that shoulder bone, and you want to go in at a 90-degree angle. If you go in too high, you can actually give the IM injection into the bursa. That will cause bursitis. That is not a good thing. If you go too low, you can hit the axillary nerve. Not good either. So keeping that safe zone in mind is super important. Vaccine-related reactions that are common include tenderness or redness, swelling at the injection site, low-grade fever, or chills. Fever usually only lasts for 48 to 72 hours, not longer than that. You can also see fatigue, headache, myalgias, which all can be taken care of with acetaminophen or ibuprofen, alternating between the two, other supportive measures. What is abnormal, though, is shoulder injury related to vaccine administration, particularly poor vaccine administration. You can also get abscess, and I'll show you a picture of a pediatric patient with an abscess due to improper aseptic technique. And then if you give a gluteal injection, if you are unfamiliar with the anatomical location, you can develop, or you can hit that sciatic nerve, and you can actually cause sciatic nerve damage. So we're going to spend a few minutes on the abnormal so that you don't make those mistakes when you are giving injections. Shoulder-related injury to vaccine administration or SERVA is unfortunately more common than we would like. It is related to administration techniques, so keeping that proper technique in mind is important to prevent these from occurring. It most commonly occurs because of an inflammatory process, because you've injected either the bursa, the tendons, or the ligaments. And you can have patients who have limited range of motion. The symptoms usually begin within 48 hours of administration, but they do not improve with over-the-counter medicines. And so we would treat these patients after a physical examination with routine agents like steroids that are common for inflammatory injuries, other inflammatory injuries. Another consideration with shoulder injury caused by vaccine administration or related to vaccine administration is not only the location, not too high, not too low, but it can also occur because the needle was too short or the needle was too long. And so in smaller individuals, you may want to use a length that is smaller, and likewise, if there is a bigger individual, you may have to use a longer needle to make sure that you are hitting muscle. Selection of needle size depends upon the size of the person and sometimes the vaccination that you are giving. But typically, infants and toddlers, particularly when you're in the vastus lateralis, you're going to use 1 inch to 1.25 inches. If you are injecting the deltoid muscle of a toddler or a smaller child, you can use 5/8 of 1 inch to 1 inch. And then those larger children, closer to 10 years of age, particularly when you are injecting into the muscle of the anterior lateral thigh, you're going to use a longer 1.25 inches. In adults, you're typically going to either use 1 inch to 1.5 inches, and it's a general rule that you can use a smaller needle for men and women who weigh less than 60 kilograms. There are age cutoffs for injection sites for infants, and so less than 12 months you are going to inject into the anterior lateral thigh only, and as that infant becomes a toddler and they are over 12 months, you can start to inject in the deltoid muscles. The recommended injection site for an infant or toddler is in the middle third of the vastus lateralis, and that's the anterior lateral thigh. And to locate that correct position, you want to make sure that the infant's leg is completely exposed, and then you locate the upper and lower anatomical landmarks, which is the greater trochanter of the femur and then the patella, and you're going to draw an imaginary line between those two landmarks down the front of the thigh, and then imagine that the thigh is divided into thirds, and you're going to go right in the middle of those landmarks. The site of the injection should be visibly clean. This is an example of an infant who had eczema at the site of an injection. And of course, if there is eczema, you may want to choose a different location for vaccination if possible. And of course, we alcohol swab off the injection site prior to administering the vaccine. This is a part of aseptic technique, but in this case, an abscess did occur. Staph aureus was identified from the culture, and this is just one example of the risk of an anterior lateral thigh administration site. For gluteal injections, the site of the injection is the gluteus maximus, and you can see depicted on the diagram if you divide the right and left buttock into 4 quadrants, and you are going to use the outer and upper quadrant. The reason that you inject into that quadrant is because the sciatic nerve and other arteries are not in the upper and outer section, and this is the proper site for a gluteal injection. All of these injections are given at a 90-degree angle as opposed to subcutaneous injections, which are typically given at a 45-degree angle. But IM injections should be given at a 90-degree. It should reach the muscle. If shoulder injury occurs, if you have hit the sciatic nerve, if your patient develops any significant adverse event after vaccination, it is highly recommended to report the vaccine adverse event to VAERS, and the website is here. We give paperwork to every patient that has either a QR code or that website on it. We give everyone, because it's required by law, the vaccine information sheet, and it does tell a patient how to report an adverse event to VAERS. For those of you who are looking for supplemental vaccine training, the Tennessee Pharmacists Association provides resources, training, certificate programs for pharmacists and pharmacy technicians. APHA offers free online video instruction that demonstrate proper technique. The CDC has developed online vaccination resources, and I've listed these here for you and wish you the best as you seek out proper technique.